Hello, I am Dr. RMD, your NEET PG strategist. The most common question that I get nowadays is students ask me, sir, we are preparing for NEET PG 2026, but INICET is on the way. So should I prepare for INICET? Should I give a short revision in last 1 month, or should I directly focus on NEET PG and keep INICET aside? So the answer to this totally depends on where your preparation is currently. If your preparation has finished one read, that is one complete read, then for revision, you can actually select few important subjects and then appear for INICET. If you ask me, which is the most important part for INICET preparation, it is always INICET previous year topics. Now, previous year topics or previous year question explanation will constitute around 40 to 50% of entire INICET papers, because INICET exam started in November 2020. Examiners at AIMS don't have long experience creating INICET papers. It is just for last 4.5 years. That is total 9 sets of question papers are available. So that's why questions, if at all, which will repeat, that is from PYTs and PYQs, will be from these previous year topics only. So if you see last few years papers, around 50 to 60% of topics are asked from these INI papers only. What are the constituents of rest of the topics? Rest of the topics are asked from hot research topics. Now, what are these hot research topics? For example, in AIMS Delhi, in pediatrics department, their focus is only on genetics. That is because genetics is an evolving branch, and no institute other than AIMS Delhi is as concerned about genetics as AIMS Delhi pediatrics department. They have separate genetics department. So their researchers are mainly focused on diseases like neuromuscular diseases, spinomuscular atrophy, Duchenne muscular dystrophy, lysosomal storage disorders, glycogen storage disorders, therapies for that, enzyme replacement therapies, gene splicing techniques. So these are hotspot research topics in AIMS, and these are the questions which the examiners, who will set AIMS question papers. AIMS question papers are set by professors. They are set by HODs of these premium institutes only. So if you ask me what questions will be asked by NIMHANS professors will be only concerned about psychiatry, evolving new neuropsychiatric techniques. Okay, similarly psychopharmacological methods. That's why you'll see from November 2020 onwards, many new questions in psychiatry are being asked, and these psychiatric questions are a bit of more of difficulty level questions, because they are not very simple questions. Similarly, when you see anatomy, more questions are being asked from neuroanatomy. If you watch my INICET analysis video, you'll notice that 30% of questions come from neuroanatomy under anatomy. So if 8 questions are asked, definitely 3 to 4 questions are only going from are coming from pure neuroanatomy only. So you should realize that INICET has a specific pattern which NEET PG doesn't has. INICET has a specific pattern, and their patterns are based on two things. One is the hotspot topics which are asked repeatedly, and second is these hot research topics. And these hot research topics is what separates INICET from NEET PG. So if you ask me whether you should go for INICET or whether you should go for NEET PG preparation, it depends on when did you complete your first read. If you completed your first read by March end, then you should definitely give a try, because 45 days are more than enough to give one read of whatever topics you have finished. I know nowadays none of you study main notes. Everyone goes for rapid revision or BTR only. So it is possible with rapid revision and BTR to do one complete revision in this last 45 days. So if it is 45 days, then 5 days you would have given for GTs, and rest in remaining 40 days you would have given time for various subjects, in which you will get 3 days of time for major subjects. Now you will ask me which are the topics, subjects which are more important from INICET perspective. There are actually major subjects: patho, micro, pharmac, medicine, surgery and OBG. These 6 subjects will have around 50% of representation. Rest 4 subjects are pediatrics, physiology, anatomy and biochemistry. So if you watch my INICET strategy video, which I released 1 month ago, you'll note that from these topics only around 150 questions are asked. 150 questions from just these 10 subjects. So I have also compiled a list of PDF, a list of previous year topics of INICET from 2014 onwards. If you are using main notes, you can also go through that selectively, so that you don't end up reading each and everything that is required. You can only read those things which are necessary only. Okay, those previous year topics only. Link for the PDF is in the description. If you want any strategy regarding personalized strategy, or you want to talk to me directly, you want an online consultation, you can always book appointment with me. The link is also in the YouTube description. So what if you haven't completed your first read? Then my suggestion is, quickly finish your first read before May 16, because before May 16, if you finish, only then you'll be able to give 3 revisions. Your first revision should be between May 17 till July 30, so that you get July 15, sorry, so that you get total of 60 days for your first revision. Because this first revision actually decides what extent you go. There are 2 types of preparation. One is preparation in depth, and one is preparation by breadth. Breadth means how much topic you can cover, and in depth means particular topic, how much depth you have to go. Your breadth depends on how much time you give for your first revision, and your in depth depends on how many revisions you can give. So NEET PG is like a balance. So on one hand you have content, and other hand you have time. If you increase content, you will require more time, but you don't have time. So you'll have to keep the time balance always constant. So time will always be less, so you'll have to manage content accordingly. The second balance is between content and revision. If you do more content, you won't have time for multiple revisions, and if you do less content, you will have time for multiple revisions. But the problem becomes inability to solve MCQs, where application comes into effect. So all these things I have been discussing in my videos, in prior videos, everything. So you can go watch those things. So this was a quick update regarding this. I'll be releasing a video in the coming week regarding last 7 days of INICET preparation, what exactly you should study in last 7 days. If you haven't seen a PDF that I had devised for last 7 days preparation, that is INICET checklist, please go through that. In this PDF, you will get detailed list of all topics. Each subject there are around 20 topics, and you will get explanation and images also in those. Link is in the description. So all the best for the upcoming INICET. So remember my techniques, remember my strategies, and apply them. If you have any doubts, please reach out to me. Thank you.